Hello, everybody, and welcome to another ICS podcast episode. My name is Shannon Wallace, and this is my ICS workshop series where I have the opportunity to talk to one of the chairs and some of the speakers from our ICS workshops that are going to be presented this year at ICS 2024 in Madrid, Spain. And it's only a few months away, so we're getting close to getting to see everybody in person in Spain in just a little bit. So we're really excited. And today I have the opportunity to talk to the chair of workshop number 4. So this workshop is Ethical Considerations in Continence Care for Adolescents. This workshop will be on Wednesday, October 23rd from 10:30 to noon. And it's actually a workshop that was put together by the ICS Ethics Committee. So this is a free workshop, meaning that if you go online and you register for the ICS conference, you can register for this workshop and there's no payment. It is free for our members, and anybody who would like to join and participate is welcome to do so. So I'm very excited to have with me today Dr. Bill Gibson. Dr. Gibson is an associate professor of geriatrics at the University of Alberta and is also the chair of the ICS Ethics Committee. And so he is here to talk to me today about his workshop and kind of give some background and so a little bit of a sneak peek into what they're going to be presenting in October. So thank you so much, Bill, for joining me today. I really appreciate it.
So thank you for inviting me, Shannon. It's always a pleasure.
So Bill, this is a really kind of interesting workshop because there are quite a few ICS members who don't necessarily see patients that are children or adolescents, but there are quite a few that do, and this can be a challenging population. So kind of tell me about the idea behind ethical considerations in continence care from adolescents. Why did you guys feel like this workshop was really necessary for our ICS members?
I think the idea behind this workshop was really thinking about vulnerability, because last year we delivered a similar workshop looking at vulnerabilities of older adults, and clearly as a geriatrician, that's the group I tend to deal with. Although we do see younger adults in our clinic, I do very little work with adolescents. But the transition from the dependent child into the independent adult is a challenging time for everybody. I'm sure we all remember back to our own adolescence. There's a lot of issues that arise around defining one's sense of self, around developing as a person and starting to make your own decisions. If you're a young person who's also living with additional needs like incontinence, that throws up a whole gamut of additional problems, and those often come into an ethical dilemma and create ethical problems for people. Parents will be going from caregiver roles to supporting roles to really spectator roles. And as children and young adults develop their own identities and their own abilities, we as professionals need to be really careful that we are treating them in an ethically informed way, both making sure that we are identifying a young person's agency and allowing them to make their own decisions, but also supporting their parents and their caregivers as that transition happens. So we wanted to look at this group and continence care in this group because it does get so inordinately complicated. And we're going to be using a case-based approach using the 4-box model of medical ethics. So that is where we will be looking at the clinical features of the case. We're looking at the medical indications, the patient preferences, the quality of life, and then the contextual features. Looking at 3 quite separate cases covering both urinary and fecal incontinence, and thinking about some of the challenges and the difficulties that arise in this group of very challenging and potentially vulnerable people.
I think that is such an interesting and kind of a topic that we really sort of brush over and don't really think about much in our daily lives when we see these patients, but a very challenging time for this particular age group. Tell me a little bit more about the 4-box model. I've never heard of that before.
Yeah, so the 4-box model is a way of splitting up a case or an individual related ethical dilemma allowing us to look at different facets of it. So the medical indications would be things like, why is this person developed incontinence, or why does this person not develop continence is the more likely situation in this group. Are there surgical options? Are there devices like catheters? Are there medications that can be indicated? And what are the medical questions that we need to think about? Then we think about the patient preferences. What does the individual want? Do they prefer to use a handheld device? Do they prefer to use an indwelling catheter, an intermittent catheter, whatever it may be? And along with patient preferences, we would also want to think about caregiver preferences, and is the patient the only person who's going to be involved in their own continence care? Obviously, if you have a young person who's got perhaps mobility issues, if they have paraplegia or tetraplegia or cerebral palsy, maybe they'll be needing a caregiver that may be a parent to help. So what are their caregivers' preferences, and how do they marry? Who becomes the most important person in that conversation? Does the parent, does the caregiver have a duty to provide continence care that they're uncomfortable with? There's lots and lots of dilemmas that very quickly arise. You start off with a fairly simple question of what's the best way of managing this young person continence, and then very quickly lots and lots of different challenges come in. The third box is quality of life. Quality of life is a really sort of nebulous concept, isn't it? What's the best outcome here? What are we hoping to achieve? Do we have to go for dryness? Do we accept a catheter? How do we measure quality of life? What does quality of life mean in these contexts? What's the most important thing in someone's quality of life? We have some people for whom being able to go to school and not be seen as different is the most important thing. Some people it's being able to avoid infection. It's lots and lots of different priorities, different questions start to arise. And then the final thing is where it gets really interesting, is the contextual features, which is where you're not just having a nice simple, this 65-year-old woman who's had 4 children has stress incontinence and she needs a sling. That's no dilemma there. 16-year-old with spastic cerebral palsy who self-catheterizes, who's beginning to develop a interest in having sexual relationships. How does that, what are the contexts there? How does all that come in? So there's lots and lots of really interesting conversations to be had. The 4-box model is a way of allowing us to break down these really complicated situations and start to think about them a little bit systematically. As we teach our learners, you start off with a very complex problem. You can break it down into smaller, less complex problems and then bring them together at the end.
That's a really interesting model that I've never heard of, and I'm sure many of our members haven't heard of either. So it's fascinating to think about these patients that we see in our clinic and kind of think about it from a different angle than what we normally do on a day-to-day basis. So I think that's given us a good sneak peek of what our ICS members can anticipate from thinking about these cases from that 4-box model system. So tell me a little bit about the speakers and maybe the cases that you are going to be presenting during this workshop.
We have a really high-level group of speakers. So we have Ashani Coleman, who's a urologist from Melbourne, Australia. We have Davina Richardson, who is a nurse continence advisor who works for the Bladder and Bowel UK. She is an expert in adolescent continence care. She's going to be giving us a case. And we have Marilena Gubbiotti, who is a neurourologist from Perugia in Italy. So I'm going to be giving an introduction to the ethical framework that we'll be talking about. I'm going to be talking about the 4-box model and the other sort of features of medical ethics around autonomy, beneficence, non-malfeasance, and justice, which are concepts which I think most people will be familiar with. I'm going to be going into those in a bit of detail. And then we have 3 quite different cases, one from each presenter, covering issues around both urinary and fecal incontinence in children and young people of differing ages. And my co-speakers are going to talk through each case, present the case, and then this is not 4 lectures. This really has to be an interactive workshop. So I would very much encourage the participants to come along and be ready to engage in a discussion and bring their thoughts. These are not going to be questions with right answers. This is not 4 people saying, here's the situation and here's exactly how you handle it. we're going to be giving people a framework to think through and allow sometimes quite challenging and difficult conversations with young people and their parents or their caregivers, in order to allow people to find ways of maximising the quality of care that they're able to give within an ethical framework. And we are hopefully going to be concentrating on the ethics of the continence care, not the continence care itself. So this is not going to be a conversation about which catheter is best or which is the best anticholinergic for a 15-year-old. This is going to be, how do we make the decision to use these treatments?
I think that this workshop is so different from the types of workshops that are, typically presented at ICS, or the workshops that maybe when our members are browsing, that are focused on kind of the surgical, medical aspects of patient care, whereas this is something totally different and really sort of, you guys are shining light on a kind of a different way of looking at patients' care and working with that patient and the family and, the other healthcare providers, to kind of come up with the best solutions, which I think is really challenging and probably a conversation we should have more frequently and don't. So I think so that being said, what is your kind of target audience for the ICS? Like what in our ICS membership, who do you think would be most benefit from this sort of workshop, or who do you think would be get a lot out of the cases that you guys are going to present and the discussion that you're going to be having?
I think the people that really need to come are the people listening to this who are thinking, I don't need to go to that. Because I think it's really important for everyone involved in any kind of, whether it's frontline healthcare professionals delivering care or people organising services and making decisions about what's going to get funded. These concepts of ethical treatment are absolutely fundamental to everything that we do. And although, yes, we're using children and young people as a framework here, and a lot of the issues that we discuss are going to be specifically talking about that group because there are specific ethical issues and dilemmas that arise in that group. These are concepts which are applicable to every patient that we see, from kind of 5-year-olds up to 105-year-olds. Everyone has autonomy. Everyone should be subject to beneficence. Everyone should be subject to non-malfeasance. Everyone should be subject to justice. So whenever we're making any kind of treatment decision or management plan or service delivery model, whatever it may be, these are principles that we should all be adhering to. I think one of the great things about going to ICS is it's such a multi-professional organisation. There are people from all over the world, from every, we have paediatricians, we have geriatricians, we have surgeons, we have neurologists, we have physiotherapists, we have nurses, we have occupational therapists. Everyone is there, and really it's one of the societies where everyone's voice is very heard. Continence care, by its very nature, is a really multifactorial and multi-professional subject, and you can't just go in and fix it with one drug or one operation. You need to do everything else. And I think really there's people who think that they don't need to know about medical ethics are the ones who really do need to know. So I think it's going to be a really interesting workshop. I'm not a paediatrician and I do not deal with adolescents. So although I actually wrote the workshop, I'm really looking forward to going to it because I think I'm really going to learn something about how we can apply these ethical principles to a very different group of people to I normally deal with. So I'm really looking forward to it. So I'm definitely going to go, and I think really anyone who is in Madrid should also go.
I'd also agree that everybody listening should come to ICS in Madrid. And I do agree with you, Bill. I think the broader implications of this workshop, where you can apply some of these principles to everyday practice and the patients that you see, and it's not something we really discuss or really talk about in our particular specialty in terms of healthcare, oftentimes doesn't focus on these ethical principles maybe as much as it should have, and it's not brought into our practice or brought into our learning, which is one of the reasons why the ICS created the Ethics Committee, because they thought this was a really, these principles and these ideas and the way that we think about these problems should be in an ethical context like this. And for you and your team to put this workshop together so it's sort of tangible and like understandable to kind of I'll call myself the lay person who really doesn't know or understand. I mean, I didn't know about the 4-box model. I'm not very good at remembering, the ethical principles. So this is a perfect workshop, especially for somebody like me who doesn't spend a lot of time thinking about this and maybe, should consider this more in the future. So I really appreciate the time that you and your team took to put these cases together and put in a great program. Before we end here, and I thank you so much for your time that you spent with me, any other last words to our membership or anybody who's listening, maybe thinking about becoming a member, thinking about coming to ICS in October, any parting words?
I think if you are in any way interested in continence and incontinence in any context, in any sort of professional background, you should absolutely be an ICS member. It's about £100 a year, $160. It's a really inexpensive society to join. It's a very friendly society. There's an awful lot of opportunities to get involved, from just reading the journal and coming to conference to, finding yourself accidentally chairing one of the committees. It's a very, very welcoming bunch. And I think this is really important work. And, you and I obviously, Shannon, talk about bladders all the time because it's what we do. But, generally people don't talk about incontinence. We know what half of people with incontinence never mention it to anybody. If you're involved in healthcare, you will be dealing with patients whose lives are being ruined by incontinence. And there are lots and lots of ways that we can make it an awful lot better. So it's really something that I think is underserved. It's not trendy, it's not sexy. It's, no one wears a yellow ribbon to raise continence awareness, unfortunately.
Maybe they should.
Maybe we should. Absolutely.
That, Bill.
There's Continence Awareness Week, and it sort of slides by and it gets very little coverage. But I think we need to get out there and spread the word and tell people that they don't have to just wear bulky, expensive pads and feel wet and horrible for the rest of their lives. We can make things a lot better. And the best way of doing that is to join the ICS, come to a conference, meet people who've been doing this, and there's an awful lot of work to be done. And I really enjoy it, and I'm sure you do as well.
I do. I one of the best things I ever did, I echo your thoughts, was become an ICS member and become involved in the committees, and even if not in the committees, being involved in like some of the groups and some of the joining the workshops, meeting other ICS members outside of my profession. I mean, you're a geriatrician and you're a gynecologist, right? So, and we've served on committees together and had good conversations that have, really helped with like my growth as a professional and personally. So I do echo your thoughts. I think for anybody listening out there, the ICS is a very welcoming, warm organization who is extremely friendly to all professionals, whether you are a nurse practitioner, whether you're a geriatrician, whether you're a urologist, whether you're a pelvic floor physical therapist, whether you're a nurse, whether you're just starting your career, just ending your career, in the middle of your career, and you learn so much from this organization and the people that join it. So with that being said, we're very excited for ICS 2024 in Madrid. So we will see everybody in Spain from October 23rd to October 25th. Registration is open, and when you register, you can go on and also register for the workshop number 4, which is, again, like I said, it's free, and it's the ethical considerations in continence care for adolescents. It's on Wednesday, October 23rd from 10:30 to noon. And so, I will see all of you there, and Bill and I hopefully will get, the room will be filled with people for wanting to hear about the 4-box model who didn't know it existed before. Well, thank you, everyone. Thanks, Bill, for joining me today, and we'll see you in Madrid.